Good morning everybody, I am Dr. Swapnil Shah and today I am going to demonstrate you about YVC microneedling fractional RF radio frequency, which is an US FDA and KFDA approved machine marketed in India by Skin Aesthetic Pune. Microneedling RF, as we all know, has changed the treatment of scars, at least in patients with pigmented skin. With fractional lasers and ablative and non-ablative lasers, the scars can be treated well, but they are associated with downtime, and we have limitations of choosing the fluents because of chances of post-inflammatory hyperpigmentation. Also, there is a lot of downtime if we use a fractional ablative laser. The downtime is typical of 7 to 10 days. Using microneedling radio frequency, we are going to deliver the radio frequency inside the skin. There is only a needling damage to the epidermis, which without any thermal damage to the epidermis. So we are actually delivering the energy where we want to deliver at a depth of scar which is around up to 2 to 2.5 mm in an usual patient. So this machine is a 61 watt machine. It has some unique features which are not found in any other microneedling radio frequency. It is based on two frequencies, 1 MHz and 2 MHz. The company recommends 1 MHz to be used for the treatment of wrinkles, photoaging and skin tightening only. And the 2 MHz radio frequency is used for treatment of scar, stretch marks and open pores. Depending on these two, they have two needles, two sets of needle. One set is a non-insulated needle which is used with 2 MHz radio frequency, and which is used for treatment of acne, scars and pores. And another needle is an insulated needle which is to be used with 1 MHz radio frequency, and which is to be used, as I mentioned earlier, for the treatment of wrinkles and scars. So today we are going to see patients of acne scar going to be treated with YVC microneedling RF. Now this is a patient of acne scar. She is treated with a course of isotretinoin and topical retinoids and presented today for treatment of acne scars. If you see, she had predominantly ice peak scarring with some box scars. So ideally you should combine this patient with a treatment subcision followed by microneedling RF. We do not combine subcision and microneedling RF in one session because it changes the subcision changes the impedance of the skin, and the treatment with RF becomes very aggressive. So we typically pace these two treatments at 15 days apart. So I did one session of subcision for her, and I'm going to do a microneedling RF for her today. There are few parameters, like you have to choose a diode color. I mean, that's one point where it is said to be accelerate the healing. So we choose around a red color, which is typically used for that. We are going to use 2 Hz as a radio frequency, 2 MHz frequency of the radio frequency, and we are going to use the hand operated foot switch. It has two options, whether you want to operate the radio frequency with hand or foot. Now coming to the level, the machine displays level from 1 to 10. The needle depth can be adjusted from 0.5 to 3.5. Typically we are going to use around 2 to 2.5 mm of needle depth depending on the types of scar. Here, since the skin is very thin, I'm going to use around 2 mm of needle depth. The pulse duration is from 100 to 800 milliseconds, and here I'm going to use 500 milliseconds, and the needles are coming up. So this is a typical of step up motor. Like you see the smooth insertion of needle, ejection of needle and reverting it back. So this motor is called as step up motor. The principle is very simple. You have to keep the handpiece parallel to the skin. Do not press it too hard, just touch it very lightly, and then you have to press the button. So I have entirely treated an affected area with gel in less than 5 minutes time. So I'll change the parameter for the second pass now. Second pass will be typically given at 1.5 mm. 1.5 mm. The parameters needs to be reduced. If you don't do that, there will be a chance of epidermal burn or typically the needle marks which remains on the skin. They'll take care of the active acne which are present along with it. So this completes the first pass. For the forehead and nose, I'm going to still decrease the needle depth at around 1 mm, pulse duration at around 300 milliseconds. This completes the treatment session. Now, if you see, there is a good erythema and edema of the skin, which will last for typically for 2 to 3 hours. After that, there won't be any telltale sign of treatment being done on the patient. Patient will have some swelling of the skin for 1 day. After that, there won't be anything. There is no other downtime. Other than that, we don't expect much of complications or consequences treating this. The treatments are typically done between 1 to 2 months each, with a gap of 1 to 2 months, for typical of 3 to 5 sessions. Thank you.